I just wanted to let you all know that this is going to be a recorded webinar, so that if you have any colleagues that would like to see this that weren't able to make it today, or you'd like to reference it later, we will make the recording available to you. And also, I wanted to let you know that you can ask questions while we go through our presentation as well. Just use the chat box. I'm going to keep everyone muted today until the very end. And before we get into our rabies presentation, I'm going to actually give you a preview of one of the resources that we've developed for all of you. It's going to be a SharePoint site that will be available for all of you to seek resources related to communicable disease epidemiology. And probably by tomorrow, Mark will be sending you out login information. So this is going to be a protected site that's not available to the public, and is something that you'll need a username and password to access. But once you have that, you'll be able to log in and access frequently used links. Over on the right-hand side, we have different folders for each of the jurisdictions participating with us in the Foundational Public Health Services work. And each of those jurisdictional folders will also be locked down so that they're only available to be viewed between the jurisdiction in the folder as well as Spokane, so that we can share information about cases. And then also over here is a folder where we can put specific resources related to communicable disease work. And I just wanted to give you a little bit of a preview for rabies today, since there will be a lot of references that are resources, that I'll be referencing here, that you'll be able to find in this folder by tomorrow once you're able to log in. A couple of those resources we sent out via email so that you could have them ahead of time and look at them while we're going through things in this presentation. But there are quite a few more things that are interesting and useful and handy to have. So we just wanted to give you a little preview of what you'll be able to see tomorrow. And now, without further ado, we'll go ahead and open up our presentation here. So today we'll be talking about rabies prevention almost entirely. In the beginning, we'll talk about the rabies virus itself, but for the most part, we'll be talking about rabies prevention. And I just wanted to mention that the cost of rabies prevention annually in the United States is thought to be about $300 million a year. That's an estimate from the CDC. And what goes into that figure are vaccination of animals, animal control programs, the maintenance of rabies laboratories, and medical costs related to primarily post-exposure prophylaxis. So it's an area that, while human rabies is rare in the United States, it's something that its prevention costs quite a bit of money in the United States. So briefly, I'm just going to do a quick little overview of what the rabies virus is. The rabies disease affects the nervous system of all mammals. It only affects mammals, and it causes rapidly progressing fatal encephalitis. It is almost always fatal, unfortunately, and again, while it's very rare in the United States, about 50,000 human cases occur each year worldwide. And you can see here in this slide what the primary reservoirs are for rabies in the U.S. While most human cases occur from bat exposure, you can see here that there are other mammals that are reservoirs in the country. Though in Washington, Oregon, and Idaho, bats are the primary reservoir. Dogs remain a common exposure source in many other countries. In fact, they represent about 90% of human exposure to rabies in other countries. But in the United States, rabies in dogs is thankfully rare. And I also wanted to touch a little bit on rodents and rabbits, since we do get a lot of phone calls from the public about concern over rodent and rabbit bites, but these are not a reservoir for rabies. None have ever tested positive for rabies in Washington State. We have almost 100 years of data. Eastern U.S. raccoon rabies can occasionally spill over into large rodents, especially woodchucks, so this is rare. And you'll almost never recommend post-exposure prophylaxis unless the rodent or rabbit was rabbit acting, and we'll talk about what that means in a moment. The transmission of the rabies virus occurs through saliva that's been introduced through broken skin, either through a bite or scratch or mucous membranes. Bite is the most obvious one. Scratch can occur if an animal has been licking its claws and then scratches into a person. That's a possible exposure. Rarely are intact mucous membranes an issue. There have been documented cases, though rare, of aerosolized rabies in caves. Uncooked meat and organ transplants is theoretical also, though quite rare. An animal is contagious with rabies when virus is present in the saliva, not during an incubation period. And the rabies virus enters the brain and replicates and travels through the salivary glands and is excreted into the saliva. And this is just a slide that kind of goes over the pathogenesis of rabies if a dog that was rabid bit a human. The virus enters via an animal bite and replicates in the muscle at the site of the bite, and it travels in the peripheral nerve via retrograde movement. The spread occurs from the central nervous system along nerves to various organs, including the salivary glands. And it's important to remember that the virus is traveling through the nerves and not the blood, and this is what distinguishes this virus. And also important to remember is that the closer that the bite is to the brain, the shorter the incubation period. And this is just another example of that same slide, just with a raccoon as an example. You can check that out a little bit later. So the clinical signs of rabies really vary by the species. And even within the same species, the virus presentation sometimes doesn't even go through all of the phases. And again, also the incubation period depends on the dose, the route of inoculation, and the strain of rabies. These are the three phases here, but in general, in animals, the first symptoms of rabies are going to be really nonspecific and might include lethargy, fever, vomiting, and anorexia. And the signs can progress within days to cerebral dysfunction, cranial nerve dysfunction, ataxia, weakness, paralysis, seizures, difficulty breathing, difficulty swallowing, excessive salivation, abnormal behavior, aggression, and self-mutilation. We kind of went over this a little bit earlier, so I'll just kind of leave this here. I apologize. Probably the most, the most significant risk in our state is from bats, and I just wanted to include this picture here of a little bat in his mouth to represent how small the mouth and the teeth are. So people can have exposure to a rabid bat through a bite or a scratch that they don't know about because it's so small. So that's one of the primary reasons that post-exposure prophylaxis is recommended when a bat isn't available for testing, and if it's found in a room with someone who's been sleeping or intoxicated, or if there's an unattended child who couldn't describe what may have happened, or in somebody who had been mentally handicapped. And you'll often get calls also about things that really aren't considered an exposure from the public health perspective. So contact with fur, blood, urine, feces of an animal. None of those are considered to be exposures to rabies. Being sprayed by a skunk is not a risk for rabies. And contact with inactivated virus is also not a risk. So this virus is actually quite fragile and is inactivated by ultraviolet irradiation. If the material containing the virus is dry, like if your bat that somebody found is dry and crusty, the virus can be considered non-infectious. And then this is just a slide that talks about the rabies cases in Washington. So the positive findings of bats that are shipped for testing is about 5 to 10% of those that are tested. But it's important to remember that most of the, not most, but many of the bats that are shipped for testing might be sick or injured, so that percentage is likely to be higher than what the actual rabies percentage is in bats in the wild. So it's thought that less than 1% of bats in the wild actually have rabies. Other animals, historically, we've had dogs, cows, cats, and other, but in the last 30 years, there have only been 2 cats that have tested positive for rabies, one in 2002 and one in 2015. one llama in 94 and a horse in 92, and they were all bat variant strains. Human cases are very rare. In 95, there was a child with a bat exposure in the bedroom that ended up passing away in, I believe, the Walla Walla area. And in 1997, there was also a man who passed away with a presumed bat exposure. He had bat variant rabies as well, but no proven exposure. And this is something that you can access on our website also, just the rabies activity in Washington. So you can see here the number of bats that test positive for rabies by the county of submission. So not necessarily the county where the bat may have been found, but the county that shipped the bat. And this is for 2017, and you can see that 22 out of 376 bats tested positive for rabies. And with that, I'm going to turn things over to Sandy. I just wanted to double check and make sure that there weren't any questions. Sandy's going to talk to you about animal bite processing and shipping and testing for rabies. She's been with the Spokane Regional Health District for almost 18 years and has worked in 10 years in the zoonotic program and currently serves as the lead for the zoonotic team as an environmental health specialist. So I'll turn it over to you.
Hi, everybody. This is Sandy. Yeah, so I'm going to talk about animal bite processing and shipping and testing for rabies as we do it here at the Health District. So for processing animal bites and exposures, we receive animal bite reports typically from our animal control agency here called SCRAPS. And then there's a couple of other shelters as well that we occasionally get reports from. We also get reports from medical providers. They do not feel comfortable sending their reports directly to animal control. So they send them to us, and then we forward them to animal control, who follows up on the incidents. We also receive wild animal contact reports, and that can be anything from a pet encountering a bat or a raccoon, which is pretty common. We've had a lot of dogs running in with raccoons the last few years, and possibly skunk or coyote or something like that. And we receive those from the public and pet owners, and then also sometimes from veterinarians. We also receive reports from DOH, which they receive from CDC on imported dogs into Washington State. And those would typically be puppies that are being brought in that don't yet have rabies vaccines. So we need to follow up and make sure that they do get their rabies vaccine and that they're healthy as well. Occasionally there's rescue dogs coming into the country as well, which can be a challenge also. So here's just a couple of the reports that we've developed over time, and we keep editing them and adding to them. But we found that they work pretty well. We have one for animal control and one for medical providers, and we'll be happy to share those with everybody. Feel free to use them or adapt them for your use. And then we also have a report form that we use ourselves for intaking calls on bat exposures, whether it's people and bats or pets and bats or both, and then any other wild animals. We've got a little checkbox at the top there where we can check off which animal it is that they're exposed to. And this form is really helpful because this way you don't forget the questions to ask. You get all the information that you need. Even if you have to ship it, you should have all the information. And then we also double check on exposure. We ask the questions down about middle of the form there with the check boxes on exposure. If they captured, say, a bat, how did they capture it? Did they touch it? Did they use an implement? Did they sterilize the implement afterwards? And we usually ask those questions multiple times just to make sure because sometimes they'll catch it without even asking us. We want to make sure they didn't get exposed during that if there was no other exposure. And then so our animal control agency, they report a lot of the bites that we get. So they're out there investigating the incident before we even hear about it. So what we've developed for them is this Rabies Prevention and Animal Bites handout. And so they hand it out to all pet owners, which are usually a dog or cat owner, and then the victims of the bite as well. So for the animal owner, it gives them information on how to confine the animal for 10 days, to keep it in their home, not let it out loose, take it out only for bathroom breaks, that kind of thing. And then it also tells them what to do if the animal should develop any signs of rabies or illness within that 10 days. Basically contact us and contact their vet as well. And then for the animal bite victim, it discusses cleaning the wound and then the follow-up that we'll do. And on the back side, there's some FAQs with just basic information about rabies. So the link for that is down at the bottom of the page, if you notice. So that is actually on our website, and that can be accessed by anybody. So we here, the Health District, over the last couple of years, we've been getting about 800 animal incidents per year. This year already, we're over 500, so we may end up well over 800 this year. So what we've done is we have to kind of triage, and we investigate or follow up based on risk. So we've divided things into low, medium, high risk, and then special situations, which really refers to potential contact with a potentially rabid animal. So we have a full SOP, that would be the one on the right-hand side, and then which goes into great detail on how to process animal bites. And then on the left-hand side is just a quick reference chart, which we reference all the time. And again, we're pretty happy to share those resources with everybody. So based on risk in the animal, most animal bites end up with the dog or cat going through a 10-day confinement period. And that usually involves the animal being confined at home. In that case, we send the victim a handout letter, which I have on the next slide here, that just gives a really good background on rabies and risk and everything else. So if there's no real risk, it's a dog or cat that's vaccinated, hasn't been outside of Washington, hasn't been in contact with a rabid animal, we would not follow up unless we're contacted that there's an issue with that animal. So other animals end up being confined at animal control, and in that case, we send out the victim letter. If they have any concerns at all, they can contact us. But after the 10th day, if the animal's healthy, animal control clears it themselves. And if there's an issue, again, if the animal shows signs of illness or dies or whatever, they will contact us and we'll respond appropriately. And then it may also be confined in an animal shelter or vet office. That's a lot less often, but in that case, we'll follow up with them on the 10th day and make sure that it's healthy. For unconfined strays, if we don't find out of any known owner, which would be, up to animal control, whether or not they can track it down, we again send out this victim handout letter, and if we don't hear anything back, there's really nothing we can do. But if the victim's concerned, we'll send them to EPI or discuss further action with their doctor. And then the other might be that it has to be tested for rabies, and that's for the high-risk special situations, especially if it's come in contact with a potentially rabid animal. So this is a copy of our rabies information letter that we send out to almost every victim, really. We found it's really useful, doesn't take long to do, and generally we don't get a lot of calls back, so we think it answers most of their questions. So here I have some examples of when to test animals for rabies. So if the biting animal develops concerning symptoms indicative of rabies or dies during that 10-day confinement isolation period, then most likely we would want to test the animal. Or if it's killed during the confinement and it wasn't currently vaccinated. So there's kind of different permutations, and we have to, look at all the potential issues and often consult with epidemiologists. But an example of this is if the animal owner shoots a dog, and that unfortunately does happen. more often than we'd like. And then depends whether it was the bite happened within their family, and if they're concerned. If it's somebody outside of the family, typically we would want to test it, provided we find out soon enough where it would still be viable for testing. Another incident is when the biting animal is too aggressive to safely be handled by animal control, and they'll let us know if that's the case. And if they really feel they can't handle it, we don't want anyone else being bitten, and so they'll euthanize it and we'll send it for testing. Another incident is, if it's a wild animal or a hybrid, so like a wolf dog, technically they don't qualify for the 10-day observation period, so they might need to be tested. Potentially bats, obviously, if there's been any potential human contact, we'll send those for testing. And then for pets in contact with a suspect rabid animal like a bat or a skunk, the owner can send the specimen to Oregon State University for testing. And I think Anna has a slide with a little more information on that a little further along. But typically, Department of Health will not test unless there has been some human exposure. So example of when to test bats for rabies. I think Anna covered this a little bit as well. Doesn't hurt to repeat it though. So if there's direct contact with a bat, a bite, a scratch, or handling when they have cuts or open wounds on their hands, we definitely want to test it. If a bat's been found in a room or had access to a room, basically if they had their door open and then they found a bat in their house the next morning, then we would definitely test that bat if they can catch it. If a bat's found in a room with an unattended child, just because you can't always believe what they say, even if they say they didn't touch it, they might have. And then a bat found in a room with a person under the influence of alcohol or drugs or has a sensory impairment. And also a bat found near a child outside. That's not uncommon either, depending on the age of the child and the circumstances. Probably we'd want to test as well. Another one that I don't have on here is also, sometimes we've tested, if Department of Health will agree, a bat found in a very public place. Even if we don't have any reports of exposure, I had a case where it was at a golf course, and as it turned out, it was in the restroom or locker room. And with further questioning, I found out that it actually was used by children from the pool at the same site. So Department of Health agreed that it should be tested just in case. So we went ahead and tested. Fortunately, it came back negative. But anyways, it does depend on the circumstances. So the testing protocol, first of all, we want to consult epidemiologists, and we'll often check with our own agency epidemiologist if we have concerns or if we think that maybe Department of Health isn't going to want to test, but we think that it should be tested. But then ultimately, State Department of Health epidemiologists have the final call on whether the animal will be tested. And if we're going to be testing a bat, we need to make arrangements for the capture of the bat. And we do not go collect bats, even though people ask us to. So what we'll do is have the person collect it if they feel comfortable. And there are some resources for them to use. One is something we developed last year, and I've got a slide at the end of my section here on this, but it's called BatSmart, and it's on our website. And we have information on people and bats, pets and bats, just bat FAQs, and bats around your home. And there is information on there how to safely capture a bat. And Department of Health also has information. Their link is on the slide also. And actually our information came mostly from that website too. So it's really good information, lays it out step by step how to safely catch a bat. Now, if they don't feel comfortable doing that themselves, they can hire a licensed nuisance wildlife control operator, and they're listed on Department of Wildlife's website. I have the link on the slide there, which is really helpful. In some jurisdictions, animal control will also come out and capture bats. That's not typically the case here, except in maybe very special circumstances maybe in a really public place they might. So anyways, there are different options, and you definitely want to guide people through that, particularly in how to contain the bat so that it's safe when they transport it to whoever's going to be doing the euthanasia of the bat. So finally, need to make arrangements for delivery of the specimen. Again, need to tell them. I think we had one that showed up at our vet that does the euthanasia. Someone had a live bat wrapped in a rug, which was not safe to bring through their waiting room. One thing we also have them do is when they arrive at the vet is to go in without the specimen, and then the staff there will direct them to bring it around to the back of the building. So just in case they don't have it properly packaged, it's not going to expose anybody else. And so if there's cats or dogs or raccoons, then you have to arrange for the decap of those before sending them to the state. Bats are sent whole. They're just euthanized and packaged up in usually a specimen cup. So moving on to the next one, I've included a few slides here just on the euthanasia of bats. And that's because when I attended the Washington State Environmental Health Association annual education conference back in 2017, they had a session on rabies. And it turned out the presentation wasn't working. So we ended up just having an open discussion, and Department of Health started asking all the LHJs how they were euthanizing bats. And it came up that a lot were using unacceptable methods of euthanasia. And so as a result of that, DOH was pretty concerned about who was doing it, how they were doing it, were they vaccinated, et cetera, et cetera. And then also what LHJs were telling the public on how to euthanize a bat as well. Apparently they'd had a few complaints about that. So anyways, as a result of that, DOH put together a survey, and these are the questions here on this slide, just how they're capturing, transporting it, what are the resources that LHJs need, and then what advice do they have for other LHJs. And as a result of that, they came up with some recommendations. And again, this year at the annual education conference, Dr. Worley, who's the Department of Health, Public Health veterinarian, he presented on rabies and included a large section on euthanasia. I've got the link there for his presentation if you want to take a look through it. It's pretty good. And basically, the bullet points underneath are just detailing what, some of the highlights of it. So there's a summary of selected survey results. There's the barriers that were identified by LHJs, and then some further advice. So the next slide here just summarizes some of their recommendations for euthanasia. So Department of Health, they recommend that euthanasia be done by a currently vaccinated licensed veterinarian, a veterinary technician, or another animal handler who is vaccinated and wearing appropriate personal protective equipment. We here in Spokane have a vet that we've contracted with for many years, and so and they're located pretty close to our office, so it's pretty convenient. People don't really complain about taking the bats there, so it actually has worked pretty good for us. So I've listed here some of the unacceptable methods that they found out in their survey, things like drowning and freezing. Those would be physical methods. And then chemical means, some inhalant compounds like lighter fluid, pretty inhumane ways to euthanize a bat. And then also general anesthetics and tranquilizers. So what is acceptable is halothane and isoflurane. And those are rapid anesthetic effects followed by death in high enough doses. Apparently put them to sleep, and it's been found to be the best way to euthanize them. So here I just have a few extra resources on euthanasia on DOH's website, and they have a couple of other documents that they reference there. So once a sample's been prepared or euthanized, and you're whoever's going to prepare that specimen for you. In our case, it's our veterinarian. Then you want to package it up following Department of Health recommendations, or, well, actually requirements, I guess you'd say. And here I've got a picture of their packaging procedures and a link to it. We also have a packaging standard operating procedure that we put together, and we can also share that with everyone. And it's based on Department of Health requirements for packaging and shipping. Now, sometimes there are special cases, and if that's the case, you might want to consult with DOH Virology lab. And one example of that we found out recently was frozen specimens. So we had someone who had frozen a bat. Now, DOH wants those sent with dry ice, and there's certain ways to package it up. And there's specific labeling requirements as well. So you want to follow those. And then dogs and cats that are frozen have to put extra ice packs because DOH wants to control the thawing to make sure that the sample will be testable. And then we always ship with FedEx. And one other point on shipping, labeling is really critical. If you have like leftover parts of labels or some of the return labels from DOH sending the packages back after they've received them, they will not always ship. And we found this out the hard way when, after shipping a bat, the next day we had it delivered back to our office with the bat still in it, and then a note saying that it wasn't packaged appropriately. So now we're super careful about peeling off all the old labels. And DOH, they also have a couple other, well, they have a document that just goes into more detail on shipping specimens. I have the link for that. And then also the submittal form that goes to their lab, and that has to be sent along with the specimen, filled out completely, and then put in a little Ziploc bag in with the specimen. So for dogs or cats or ferrets that end up going through, that have to be confined or isolated for a quarantine period, for those that are healthy, vaccinated, unvaccinated, known owner from Washington, it would be the standard 10-day confinement period. However, if it's been in contact with a potentially rabid animal, these requirements all come out of the compendium, which is, the link is at the end of the presentation. So for a currently vaccinated domestic animal, which is dog, cats, and ferrets, that are undocumented overdue vaccinated dogs and cats, you want to get a booster as soon as possible and then put them under a 45-day observation. For overdue vaccinated dogs and cats that are not documented, they want to get a booster again as soon as possible, and then they'd be under a 4-month confinement. There's also now an option to go for prospective serological monitoring, which is basically doing a titer reading. I don't know of anyone that's gone through that, but that is an option that they can pursue with their vet. For unvaccinated dogs and cats, it would be immediate vaccination, and if they get it within 96 hours, then it would be 4 months isolation. For unvaccinated dogs and cats that don't receive that vaccine within 96 hours, and all ferrets, it's a 6-month strict isolation. Moving on to the next slide, just the meaning of confinement isolation for animals that are in contact with a potentially rabid animal. Per the WAC, basically, I'm not going to read through the whole text, but the animal should be kept under the owner's control and observed for signs of illness in a manner considered appropriate by the health officer. And we've come up with, along with, DOH's recommendations, some of those criteria. Basically should be confined to the residence at an animal control agency or a vet office. There's no contact with other animals permitted. Human contact should be limited only to one owner, and that's only for necessary visits to the veterinarian, would be the only time they go out of the house. Limited outside visits in a fenced yard, only under supervision, or if it's unfenced and on a short leash, and no walking in the street or trips to the dog park. And for cases where they've been in contact, particularly with a known positive bat, and they need to have veterinary care, special arrangements might be required. And that's something to talk over with the DOH veterinarian. But we've had cases where people have arranged to go after hours or at lunchtime, or the vets come outside and vaccinated the dog in the back of their car, or maybe have a mobile vet come out and treat the animal. So these are some Department of Health slides, and they just talk about the reason for the 10-day quarantine period for dogs, cats, and ferrets. And that's because those animals have gone through testing where they know what the length of contagious period is. So that drives that 1 to 10-day or that period. And then the 6-month isolation and incubation period for rabies virus. Since they're not contagious during the incubation period, the length of time depends on the various things that are listed here. And again, humans, it's weeks to months, but in dogs, cats, and ferrets, it's 2 weeks to 6 months. So the 6 months tends to be the longest period of time, and that drives the 6 months isolation period for unvaccinated dogs, cats, and ferrets exposed to potentially rabid animals. And finally, I have here's our bat resources that we have online. So we have our BatSmart website, which I talked about, good information there. And then Wildlife, they have a document on their website called Living with Bats. And this we refer people to if they have bats that are getting into their home. We don't want them to have any further exposures if they've already had one. And they can give really good information there on how to exclude bats safely and humanely so the bats aren't trapped in the home. And then also if they're having bats, say, roost under their eaves, then there's various ways that they can discourage bats. So, oh, there is? Okay, sounds like there's a question. Okay. Does anyone know what is required for a health department to obtain and maintain halothane or isoflurane? From Ron's presentation, it sounds like there aren't any restrictions. Now, he was hoping that he could obtain it and distribute it to LHJs. It doesn't sound like he can do that, but I think he is looking into it. So he definitely is a good source of information on that. And I did include his contact information back on one of the slides that I had there. So anyways, he's a good one to contact on that. So with that, I'll pass it back to Anna.
Thank you, Sandy. Let's see. Back into the slides here. Okay, so the following slides are really going to help with making those judgment calls with whether or not to test, and if an animal isn't available to test, how to proceed with an exposed person. And this resource is going to be your best friend. So DOH put together a set of guidelines. The top of the document says prevention of human rabies, assessment of rabies exposures from animal contact and guidance on rabies post-exposure prophylaxis. This document was sent in Mark's invitation for the presentation today, and there's also a link to it at the end of our presentation. But this is going to be your best friend when you're trying to make these judgment calls. It's a 14-page long document, and it has quite a bit of narrative, and it goes into more detailed explanations as to why PEP would be recommended or not, and kind of the things that you would be taking into consideration. But it also has this handy dandy little colored chart as well that is easy to reference at a quick glance. So in general, this algorithm is going to guide you through this assessment using these questions that you see here. So when you get a call about an animal bite or exposure, you first want to ask, is the animal of a species that can carry rabies? So is it a bird or is it a reptile? Then it can't carry rabies. You also want to know if there was an exposure. So was there a bite or scratch or other risks that we went over earlier? So, somebody that calls and says that they touched a bat's fur or they found a bat in the pool, those are not going to be exposures that you need to worry about rabies for. And then it also will guide you through these questions around how much risk there is with the exposure. So you'd want to consider the animal type and its health or behavior. Is the animal a rabies reservoir? Was it a bat? Was it rabid acting? Or did it appear normal or apparently healthy? You'll also want to consider the geographic location of the exposure. So you'll consider the local epi of rabies where the exposure occurred or where the animal's from if it was imported. Animal vaccination status is another thing that will play into your recommendation. So rabies vaccine is only available for dogs, cats, ferrets, and livestock. There isn't any vaccine that's licensed for other animals. You'd want to look into the circumstance of the exposure, primarily if it was provoked or unprovoked. And the guidelines go through they have a good list of what you can consider provoked or unprovoked if you're not an animal behavior expert. I am certainly not, so I reference that frequently. And you'll also want to consider the likelihood that an animal was exposed to another rabid animal. So is it an indoor or outdoor living animal? Is it someone's pet or is it a stray? Was it imported less than 6 months ago? All of those things are going to play into your assessment. And you'll always recommend post-exposure prophylaxis when an animal tests positive for rabies. If there is a bad exposure, like a known bite or scratch without test results, or if the person is unable to verify that contact did not occur, like thinking of those circumstances we talked about earlier with, say, an unattended child or a heavily sleeping person or something like that. It'll also be recommended when someone is bit by a carnivore from an endemic area without test results, or if there was an exposure to a rabid acting mammal without test results. And really, the signs of rabies are best determined by a veterinarian, but your DOH experts are always available to help if that's not something that you're able to obtain. Ron Worley will be particularly helpful to have on speed dial as well. And then certainly have a low bar if you have questions of when to loop in the CD-EPI team at DOH. But you'll want to loop in your zoonotic disease EPIs or your medical EPI who's Marcia Goldoff if there are any positive results, if you have a face, head, or neck exposure, because that will shorten the window of time at which you need to worry about making sure somebody has an answer or gets post-exposure prophylaxis. If you have an unusual animal or situation to kind of work through a scenario with, if you have monkey bites, all of those things are scenarios in which you'd want to loop in CD-EPI at DOH, but they're all really helpful. I have asked a million stupid questions, particularly of Hannah Olteen, and she's always so kind to answer them for me. This just goes over that a little bit more in detail. And you'll also want to consider your reporting in Washington. So your responsibilities as an LHJ in reporting to DOH are to report suspected rabies exposures through WDRS. Certainly any animal or human cases are going to be reported, but also those suspect exposures. So if you have somebody that you recommended post-exposure prophylaxis to, or somebody that you know started the series, there are a series of questions that you want to document that information for in WDRS. And then I just wanted to include a link here for DOH and their resources around rabies for local health jurisdictions. And when we talk about post-exposure and pre-exposure prophylaxis, there are a couple of things to keep in mind. So with pre-exposure vaccination for high-risk persons, in the next slide, I'll go over what those scenarios will be. And then post-exposure prophylaxis will include the rabies series, but also, washing animal bites, immediate gentle irrigation with water or dilute water, povidone, iodine solution has been shown to really decrease the risk of bacterial infection and rabies. Wound cleansing in animal studies has alone, even without post-exposure prophylaxis, been shown to markedly reduce the risk of rabies. So that's a really important thing to keep in mind. And regardless of the risk of rabies, bite wounds can cause serious injury and really need to be cared for by a medical provider. So it's important to refer people on for that as well. So here I've just got a list of the groups whom we should consider post-exposure or pre-exposure prophylaxis in. And you can see those here. And there's also a link to the CDC's website, which goes over this in more detail. And the pre-exposure series includes 3 doses of vaccine only, so there's no rig. And someone, if they're exposed later, they'll need 2 more doses of vaccine. For post-exposure prophylaxis, somebody will get a dose of human rabies immune globulin, as well as 4 doses of vaccine over 14 days at this prescribed period of time. And if someone is immunosuppressed, they'll need a 5th dose of vaccine and a titer check. And the CDC website also talks about that more in detail. And it's really important to remember that rabies is a medical urgency, but not an emergency. So if somebody got bit by an animal, it's not necessary to, go to the emergency department immediately. They have generally, a handful of days to get things figured out. Though it's important that decisions shouldn't be delayed for an extremely long period of time, more than a few days. The combination of human rabies immune globulin and vaccine is recommended for both bite and non-bite exposures, regardless of the interval between the exposure and the initiation of treatment. It's really important to stick to the schedule as best as you can. And another question that we get frequently is whether or not contact with someone who's receiving rabies vaccination constitutes a rabies exposure, and it does not. So there's no risk to any family members or close contacts of somebody who's receiving rabies vaccine. And if anybody has any questions about adverse reactions to both the vaccine and to the immune globulin, they're not common. So newer vaccines that are in use today cause fewer adverse reactions than the previously available vaccines. Mild local reactions to rabies vaccine like pain, redness, swelling, or itching at the injection site might occur, and rarely other symptoms like headache, nausea, abdominal pain, muscle aches have been reported. Local pain and low-grade fever may also follow injection of rabies immune globulin, but again, those reactions are rare. And where to find these, particularly the immune globulin, but also vaccine, can be challenging for a lot of people. It's very hard at times to navigate the healthcare system. In our jurisdiction, and I imagine that's the same in all of you all that are listening, the human rabies immune globulin is typically only available in emergency departments. And vaccine can also be administered in an emergency department. They'll certainly take care of somebody for their first dose. However, arrangements can be made for administration in other settings with a prescription, like at a pharmacy or infusion center. And generally, those other entities will need possibly a couple days notice to get insurance approval or to order the vaccine. But it can be done, and that can end up saving people a lot of money through, the emergency department is just really expensive to go through, and it's a long wait time. It's just really inconvenient. And another thing to let people know about also is that these medications are quite expensive. The rig is weight dependent for its dosage, and they'll charge by the vial, and it can be several $1,000s, maybe even between $10,000 and $15,000 for the dose. And vaccine runs several $100s as well. So if you're getting 4 of those in a post-exposure situation, it can be very expensive. There are patient assistance programs through the pharmaceutical companies that manufacture these products, and that information is also available on the CDC website. I've never actually walked anybody through that to try to get some help, but it's nice to know that that's out there. And we're also going to send out a spreadsheet of local, though it's largely Spokane-focused, resources for where people can obtain rig and vaccine. And Sandy touched on this just a little bit earlier, but I'm just going to briefly talk about pet-only exposures. Again, DOH will not test an animal that for certain has not a human. So for example, a cat that's been found playing with a dead bat in the basement or outside. Pet owners can self-pay for testing at Oregon State University. The cost is $95 for the test plus the cost of shipping. And they have a really fast turnaround. It's typically about 48 hours. And they have really, really detailed instructions on the process for getting something shipped over to them, and they've been great to work with. The interesting thing with having something shipped through or tested through Oregon State University is that they'll notify our state health department of any positive bats so that the local health jurisdiction of the shipper's residents can respond and talk to that person and provide them some guidance. Once DOH gets the result from OSU, they'll call the LHJ, and then the LHJ will call the person and provide that guidance, and OSU will not call the person who shipped the animal until they receive word that the local health department has notified the person and provided them with guidance. And again, refer to the earlier slide that Sandy has on the management of the exposed animal if the animal that was tested happens to test positive for rabies. And an alternative, which I didn't include in the documents that are attached to this meeting invite, but are in that SharePoint folder that I presented to you earlier, is what we're calling the Texas protocol, and it's an alternative for unvaccinated animals that have been exposed to rabies. And you can, certainly read through the guidelines when you get access to that tomorrow, but essentially it says that not currently vaccinated domestic animals that considered to have been exposed to rabies must be euthanized or vaccinated against rabies immediately, placed in confinement for 90 days, and given booster vaccinations during the 3rd and 8th weeks of isolation. And for young animals, additional vaccinations may be necessary to ensure that the animal receives at least 2 doses at or after the age prescribed by the USDA for the vaccine administered. And this is something that's not necessarily endorsed by DOH. It's something that your health officer would need to decide on if you have a situation in which this would be useful. But in a study that was conducted in the late 90s in Texas, 830 animals went through this protocol and only 4 failures were recorded. And those failures might have been attributed to delays in starting the protocol or the age of the affected animals. They were puppies. So that's something to keep in mind if you ever have a scenario in which that needs to come into play. And then real quick, I just wanted to go over a couple of case studies also before we turn it over for questions. These are some kind of common or straightforward scenarios about whether or not an animal should be tested. And you can kind of read through those. They're pretty easy. For this case study number 1, this is a bat sleep exposure. So a family of 4 slept with windows open, and a bat was found dead in their bathtub when they woke up. It was not there the night before. The parents sleep with the doors open, but the children do not, and they have the bat, and they called the health department. So our recommendation, since they have the bat, is to test the bat, and we ask the family to keep it cold and deliver it to the contracted vet's office to prepare it for shipping. 2 days later, we get the results, and they're negative, so rabies is not recommended, and we recommend that the family install screens to keep bats out in the future. And here's the same scenario, but they do not have the bat, so let's see how that makes things different. So since they don't have the bat, we are going to recommend rabies post-exposure for the parents since they slept with the bedroom door open. The children do not need to go through it since they were not exposed with those doors being closed. And we'll recommend again that the family install screens. Here's a scenario with a stray cat bite. A woman called the health department because the stray cat she's been feeding got into a cat fight with another cat, and she was bit while she was trying to break up the fight. The cat is still near her house, and she's able to identify which cat bit her. So in this scenario, we would recommend that the woman follow up with her healthcare provider about her wounds so that she doesn't develop any bacterial infection. And we'll also ask coordinate with animal control to trap the cat and place it under quarantine for 10 days, and we'll test it if the cat dies. If the cat is alive at 10 days, there's no need for post-exposure prophylaxis. case study number 4, this is the same scenario, but now she doesn't have the cat. She hasn't seen the cat for many days. So again, the woman is going to need to follow up with her healthcare provider about her wounds. And it's likely because this was a stray cat, and you can make an argument that the bite was provoked, but you don't understand really what caused the cat to get in a fight with the other cat in the first place. So because the cat is no longer recommended, no longer available to monitor, we're going to likely recommend PEP. And this is an interesting one. So this is a real scenario that Mark had maybe about a year ago. He had a zombie raccoon situation. So he got a call from a fellow who had a raccoon that got into a fight with his dog. And the man then shot the raccoon to protect his dog. And this guy had never seen a raccoon up close before, so he decided to look in its mouth. And he got cut by one of its teeth because these raccoons have really, really sharp teeth. He buried it in his backyard, and then he thought about it the next day and decided to call the health department for rabies advice. And we wanted to test the raccoon, so the guy dug up the raccoon. We ensured that his dog was up to date on rabies vaccine, and the dog got a booster, requested that the dog be observed for 45 days. And sadly, that raccoon was not testable due to damage to the brain and or decay. I can't remember if it was because the dog was shot in the brain or if it was because it was buried and decayed. Oh, it was because it was shot. Sandy's telling me she's familiar with the situation. So we recommended PEP for this guy as well. And this one's one where you just have to make a judgment call. So this is a situation that comes up with some regularity for us. We had have a situation where a person riding their bike on a trail was bit on the ankle by a pit bull as the person was riding by. The owner of the pit bull appeared to be homeless, and the dog and the owner are not traceable. So with this one, the bite was provoked. The guy I would say it was provoked anyway. The guy was riding a bike quickly by the dog, and this type of behavior isn't exactly unexpected for this breed. And while the dog might live outside, the chances of rabies is extremely unlikely. And again, this is a judgment call, but we would unlikely recommend PEP for this situation. So we have a few resources here that you can check out when we send you the slides, and I've included our contact information here. I'm going to unmute you all now and see if there are any questions. I have to figure out how to unmute you. I'm sorry, just a moment. I've never done a GoToMeeting before. How do I do this? One second. I'm so sorry. Oh. Okay, now you are all unmuted. Are there any questions for Sandy or I? Okay, hearing none, you're certainly totally able to contact both of us either via phone or email if any questions or concerns come up with any scenarios in the future. We'll make these slides available, and we will make sure that all of the resources that Sandy mentioned in her great presentation are available to you as well. And look for that email from Mark tomorrow with the SharePoint link, because that's where we will be storing things from now on. And we sure appreciate your attention and ability to attend this webinar, and we'll look forward to speaking with you with our next webinar. Oh, and we also have an evaluation that was attached to the meeting invite. If you wouldn't mind filling that out and either faxing or emailing it to us, we sure would appreciate it. It will help us in putting these together in the future. And if you have any topics that you'd like to see these monthly or every other month webinars cover, please don't hesitate to let us know what you'd like to see us talk about. Thanks, and have a great day.